Hello everyone. I hope that you all are doing fine. So we need to start this topic today, which is the halitosis. So halitosis is an unpleasant noxious odor emanating from the oral cavity, and halitosis can be self-limiting, okay, or it could be intraoral or extraoral. Definitive diagnosis can be difficult and require a thorough dental and medical history. Examination of the nose, tonsil, mucosal surface of the pharynx, and oral cavity and teeth is required. Okay, so what you need to do to find out the cause, you need to take a thorough dental history and medical history and also examine the nose, tonsil, mucosal surfaces of pharynx and oral cavity and teeth. So for these examination, you would be only doing the oral cavity and the teeth examination. The nose, tonsils, and the pharynx would be done by the different doctors. Then, what could be the common causes? The self-limiting could be if there is any dry mouth, like the patient has a habit of mouth breathing or snoring, due to which when they wake up in the morning, due to the dry mouth, their mouth would smell bad. Or they might have, if a patient has eaten anything odor causing food such as garlic, onions, or spices, or smoking and alcoholic beverages. Then what could be the intraoral causes? It could be poor oral hygiene, like if the food particles are present between the teeth or on the tongues or around the gums, that could make this bad smell from the mouth. Or there could be a colonization of the bacteria, either could be on the tongue or as a form of caries or periodontitis. Then if the infection, these bacteria has spread and now they have led to the acute infection within the mouth, either in the form of dental abscess or the oral candidiasis or the necrotizing gingivitis. So these would also brings the bad smell from the mouth, or the salivary gland hypofunction, which would lead to dry mouth and which would cause bad smell from the mouth. Then any tonsillar pathology like chronic caseous tonsillitis or peritonsillar abscess or oral cancer. Then the extraoral causes could be if there is any acute pharyngeal infection, respiratory, GIT, kidney, liver, trimethylaminuria, or ketoacidosis. So you just need to know, right? So halitosis is very common finding that we can see, but that could even be related with any extraoral causes that is going inside the patient's body as well. So you need to completely find that out by taking history and by doing the examination. Then the self-limiting causes of halitosis are common when we wake up, usually due to low salivary flow and lack of oral cleansing during sleep. Oral malodor is the result of microbial degradation of various substrate into volatile compound, which is the sulfur. The dorsal surface of the tongue is the most likely location of the microbial population causing halitosis, and self-limiting causes of halitosis can be rectified by eating or rinsing the mouth with the water and oral hygiene. Other causes of self-limiting halitosis include food, smoking, and alcoholic beverages. So these self-limiting causes, you just need to make the patient aware why these are happening. Like either could be due to the food, garlic, onion, or spices, or the due to the smoking or alcohol or the mouth breather. So you just need to find the cause and advise them with the mouth, making good oral hygiene and following certain strategies. Then intraoral causes could be like as we read in this table, like it could be any caries or infections or even the oral cancer as well. So, intraoral causes of halitosis include poor oral hygiene or underlying pathology, most commonly intraoral infections, for example, periodontal infections or pericoronitis. Although halitosis is the result of a complex interaction between the several bacterial species, the most active bacteria are gram-negative anaerobes that are associated with. So there are many bacteria that can cause the infection and leads to halitosis, but the which is most commonly seen is with the gram negative anaerobes, and that are mainly associated with the periodontal diseases. Poor oral hygiene results in accumulation of dental plaque and food debris, which can worsen halitosis. Then extraoral causes, as we read in this table, so it could be either respiratory, GIT, kidney, ketoacidosis, and sometimes there is a condition called perceived halitosis. It means there is not any detectable malodor, but patient thinks like that there is a bad smell coming from his mouth. So it is mainly psychological illness. Other people's behavior or perceived behavior, such as covering the nose or averting the face, is typically misinterpreted by these patients as an indication that their breath is offensive. Devices that objectively measure volatile sulfur compounds give variable results, are costly, and are not recommended. Then, poor oral hygiene or a poorly designed dentures or bridges can result in accumulation of dental plaque and food debris, which can worsen the halitosis. So, the halitosis causes would be this table, but if the patient is not maintaining good oral hygiene and there is accumulation of plaque and food, that would worsen the halitosis. Then, how would you manage the halitosis? First, you need to identify the cause and address the cause. Then, the self limiting causes, the management would be simple, like improving oral hygiene, including tongue cleaning, avoiding odor causing food or smoking and alcohol beverages, addressing the cause of mouth breathing if identified, considering a trial of other non-specific measures such as sugar-free chewing gum, because that would increase the level of saliva and would help with the halitosis, or ensuring adequate hydration, reducing caffeine intake. So we are just trying to avoid or rule out the dry mouth thing to avoid causing halitosis. Then management of intraoral causes of halitosis depends on the origin. And then promote oral hygiene for patients with and intraoral causes of halitosis. If improved oral hygiene and management of intraoral causes does not resolve halitosis, referral to a medical practitioner is appropriate to investigate for extraoral causes. Okay, so for the intraoral causes, you need to find out if there is any tooth decay, any gum infection, salivary gland infection problem, or tonsillar pathology, or oral cancer. So you need to find out the causes. If you cannot find any cause, then it may be related to extraoral. For that, you need to refer to the specialist. For the extraoral, referral would be the best decision. And for the patient with persistent or recurrent halitosis also, we need to refer them to the specialist. And which would be the best specialist for these patients is either the oral medicine specialist or the periodontist. Then patients with psychogenic halitosis presents a diagnostic and treatment challenge, and despite reassurance may require psychological assessment. Okay, so for the halitosis, for the self-limiting causes, the advices that you need to give is very simple, like maintaining good oral hygiene, avoiding food that leads to halitosis, and to find out the cause of mouth breathing and increasing the amount of saliva in the mouth. For the intraoral causes, you need to find out whether it is an decay, it is an gum infection, or what is the origin of this. Okay, For the extraoral causes, no matter whatever the cause could be, you just need to refer the patient to the specialist, or even the patient where the halitosis is persistent, like you have treated this thing or treated this thing, but still the halitosis is not going away or is recurrent, then also you need to refer him to the specialist, and the specialist would be oral medicine specialist or the periodontist. And the other part is the psychogenic halitosis. It also presents a diagnostic and treatment challenge, so despite only reassurance, we may also need to give them psychological assessment. So we are done with our halitosis chapter here, and topic here, and we will start the orofacial pain topic in the next time. All right, thank you so much guys for watching my video, and do like, share and subscribe. Thank you.